Tonight, we're going to look at COVID-19, the virus, the variants, and the vaccines. So the objective, as you would have gotten in your invitation, is to provide information and prevent an opportunity to answer any questions on COVID-19 pandemic and the vaccines. And I'm going to look at what is COVID-19, what is the vaccine, how the vaccines work, the development of the vaccines, look at the approved vaccines, the variants, vaccines and pregnancy, and why vaccinate, and look at children as well. Now, you may have heard recently in the news coming out Sunday that Andrew Wiggins of the Golden State Warriors, he faces ineligibility from all the home games unless he gets vaccinated against COVID-19. And this is because the National Basketball Association has denied the player's request for religious exemption to be vaccinated against COVID-19. So he will be ineligible for any home games to be played in California. And that is because the San Francisco Department of Public Health says that all players and fans must be vaccinated in order to attend or play in games. And the NBA, they have rules for unvaccinated players. They say that unvaccinated players cannot eat in the same room with vaccinated teammates or staff. They must have the lockers as far away as possible from the vaccinated players. They must stay masked or at least 6 feet away from other attendees in any team meeting. And they must remain at their residence when they are in the home market. And when they're traveling, they have stay in the team hotel with limited exemptions. They will not be permitted to visit what they call high-risk settings, such as restaurants, bars, clubs, entertainment venues, or large indoor settings. They didn't know that, the large indoor gatherings, they didn't know that players had time for that. The New York Marathon, which is coming off in November the 7th, they also have rules in place. As we know, it was canceled last year. And it will be not like what we used to see. The runners now have to produce proof of at least one vaccination or a negative PCR test within 48 hours of the race day. There's a 3-day expo before this marathon. Only persons who will be in the race will be able to attend this expo. The start of the race will be staggered, and the runners allowed to wear hydration belts in order to reduce the crowding at the various water stations, which will be staggered and dotted along the track. And family members, you cannot go to the finish line either. Coming closer home, the Cali 2021 Junior Pan Am Games, these are the rules. And these games are starting November 25th to December 5th for athletes 23 years and under. But all athletes over the age of 18, this is not a BOA rule, this is the Cali Pan Am Games rule. I'm on the Pan Am Medical Commission. All persons 18 years and over must be fully vaccinated against COVID-19, fully vaccinated, not partially, fully. And if unvaccinated, they will be tested, be allowed to take part. A random testing will be done of the vaccinated, but spectators must be vaccinated, and attendance is capped at 50%. And face coverings are mandatory. So those are some of the rules of the Cali Games coming up in November. So as Madam President mentioned, COVID-19 has really had a big impact on sports. Limited or no sporting activity. The need for protocols were put in place, sometimes no competitions, and if there are competitions without spectators, and we saw the World Group #2 Davis Cup tie a few weeks, 2 weekends or so ago. Gyms were closed, travel was limited, lack of fitness of the athletes because the inactivity increased non-communicable diseases, and a requirement for isolation and quarantine and PCR testing and vaccination and all these bubbles that the athletes are now into bubble fatigue, as you can see at the bottom here. But it is not only the effect of COVID-19 at the time, but there's something called long COVID, which you will hear a little bit about later. Myocarditis, inflammation of the heart. We have had persons who had sudden death as a result of COVID-19, haven't had COVID-19 and then returned to play chest pain, fatigue as a result of having had COVID-19 in the past, joint pains, muscle weakness. And today, Chris Gale, who was in India IPL, gone home, he says he can't take it anymore, bubble fatigue. So what is COVID-19? COVID-19 is an infectious disease caused by the SARS, severe acute respiratory syndrome, COVID, it means coronavirus, disease virus 2. And the COVID is coronavirus, CO, virus, disease. Started in 2019. That's how we got the COVID-19. And it spread from infectious persons, mouth, nose in droplets or aerosols when you cough or sneeze or speak or sing or breathe. Some people may have it and have no symptoms, but some people will experience mild to moderate symptoms, and some people, if they get it, might become seriously ill or die. Some require intensive care unit. And this is what the virus particle looks like. And this is what you hear about the spike protein, which these are the things that mutate and cause a lot of problems with the various variants that you will hear about later. As I said, it's spread by close contact with each other. When it comes in contact with the MEN, men, mouth, eyes, and nose. In crowded settings, so close contact, crowded settings, closed places with poor ventilation, and through prolonged contact with any infected person. And what are some of the symptoms of COVID? Sometimes there may be none. We do the testing all the time to see what the temperatures are, but fever, chills, cough, shortness of breath, fatigue, muscle aches, body aches, headaches, new loss of taste and smell is a pathognomonic or a particular feature of COVID-19. The only condition that you get this that is of serious, that can tell you for sure. That alone can push you towards COVID-19. Sore throat, congestion, or runny nose, nausea or vomiting, diarrhea, and then you can get things like difficulty breathing, pain and pressure on the chest, new confusion, and these are the serious symptoms, inability to wake or stay awake, and then pale blue-colored lips or nail beds or skin tone. And then the long COVID that I mentioned. These are symptoms that come on 1 to 3 months after having recovered from COVID, even if you have not been symptomatic. And these are where it would affect our sports people. The brain fog. This can be persistent. Loss of taste and smell, encephalopathy and stroke, which is brain disease. Then it can affect the lungs with a continuous cough, chest pain, or post-COVID lung disease. It can affect the skin with rashes on the skin or persistent COVID toes, which are shown here. It can affect the muscles and joint with fatigue and myalgia and poor circulation and neuropathy, which affects the nerves, and the limbs can become damaged, the blood vessels can be, because COVID-19 causes an inflammatory condition. The one that concerns us a lot is athletes, called the myocarditis or pericarditis. Myocardium is the muscle of the heart. Myo is the itis of it is inflammation, and peri is around, and this is what can happen. And we've had cases of sudden death, at least one we can think of, as a result of COVID-19 infection in the past. And of course, depression, post-traumatic stress disorder, anxiety, and social isolation are some of the symptoms that one may get as a result of having had COVID, long COVID. And long COVID, in a study in the Lancet that came out recently, showed that 68% of the hospitalized survivors, and we know we isolate everybody here, they're 6 months after they have at least one of those symptoms. 49% a year still have at least one of those symptoms. 26%, 12 months after, may still have anxiety or depression, and 23% at 6 months, whereas the other one is at 12 months. And many develop mobility problems, pain and discomfort. So you might go to the Summer Olympics and enter in the Paralympics after having COVID-19. So remember the 3 W's: wear a mask, wash your hands, and watch your distance. So that will help to protect you. So the mask must be worn properly, covering your mouth and nose. You must stay 3 to 6 feet apart. Persons who don't live with you, and even sometimes nowadays, from what it looks like, probably even if you have people that live with you, might have to do it. Avoid crowds and poorly ventilated indoor spaces. Wash your hands with soap and water. And if you don't have that, then you have to use hand sanitizer, of course. And the other layer of protection is the vaccine. Now, these vaccines have been developed, some people say in record time. Not really so. They went through the various phases, as you can see here, before we got to the vaccine part. So actually, research started back in 2002 when you had SARS-CoV-1. Then in between here, you had MERS, and now you have the SARS-CoV-2. So the body was there. We just need to put in the engine when we got the genomic sequence back in 2020 when SARS-CoV-2 was first recognized in Wuhan, China in December of 2019, sorry. So some people say these are not vaccines. These are not vaccines. Yes, they are. What vaccines do is train your immune system to create antibodies. They contain the killed or weakened forms of the germs, or in this situation, technology uses other modalities. It does not cause the disease when you get it. That put you at risk of the complications from the disease. Can be given by injection, orally, or by nose. These are vaccines generally. And how do they work? They recognize the invading organism, that which could be the virus or the bacteria. They're the security guards at the gate looking for invading persons. They produce antibodies, so they have up a shield to prevent those things from getting in your system, because you have a natural immune system that can fight them off. But in this situation, you produce antibodies, which happens naturally now, to build up your immune system against that disease. And it also remembers the disease and how to fight it. So if it goes back there again, you have the security guards recognize, yeah, you don't have a pass to come in here, don't come. And people ask, what's in the vaccine? It contains a number of things. The antigen, which is the killer or weakened form of the virus. The adjuvants is something to help boost the immune response. The preservatives to preserve the vaccine, and the stabilizers, which help to keep the vaccine good during storage and transportation. Now, you fellas know this drug, Viagra, made by Pfizer. Nobody asks what is in these drugs, but they use it. And then there's this other thing called Arouse Plus. And see what it marked for long, hard road ahead, a dietary supplement that helps to propose libido. So I asked the pharmacist, is this selling? Yeah, selling good is relatively expensive too. But the fellas buy it to get that long, hard road that they need to get for instant effect. And I said, do they ask what's in it? No, they don't ask what it is. But I know everybody wants to know what's in the vaccines. So I can say a word about efficacy, because that seems to be a word that people seem not to quite understand. So you have a vaccine with efficacy of 80%. It does not mean that it only works 80% of the time. It means that if you have a vaccinated population, 80% fewer people will get the disease if they get exposed to the virus. So you have 2, 4, 6, 8 persons here, okay? 2 are here. So if these get exposed to the virus, only 20%, those 2 people will get the disease. These other 2 will be safe. Let's look at, they say, well, you know, the vaccines are not 100% protection. No vaccine is. So you always get breakthrough infections. I heard today that there was one breakthrough infection that succumbed to the illness. They're not 100%. So you have the vaccinated and the unvaccinated and the infected, sorry. And initially you get this situation here. So more and more people get vaccinated now. They protect the unvaccinated. And that's the protection that we talk about, herd immunity. So the vaccine really is an additional level of protection. I have a dog downstairs. I have gate in my garage. I have a double locks on my door. I have burglar bars. And I have an electronic monitoring system. All are additional level of protection. And since I've been here in 1990, knock on wood, nobody has broken in. because they have to come through. So this protection, you keep your physical distance. This Swiss cheese, somebody might get through here, but then hand hygiene, that might stop it there. And if crowded, you reduce that. You wear your mask, that helps to stop some. Avoid touching your face, that helps to stop it as well. You know, and messaging, ventilation, quarantine, isolation, and the additional method, the last method that we have here now, that God gave us, the science, vaccine. But if you're vaccinated, you still have to protect yourself, you know. You still have to have proper hand hygiene. You still have to wear your mask, still have to wash your hands, keep well ventilated, and keep the distancing, and keep away from crowds. So it does not totally protect you by itself, but the combination of all these things should help to make us to be near 100%. If you look at masks, I saw a study from Tokyo recently which showed that a simple cotton mask only does about 27% protection. I don't know what Neil Merle, who was there, might tell us what kind of mask they have down there, only 27% protection. The surgical mask is about 50% protection, and the N95, not the KN95s, is up to 86, between 86 and 90% total protection. So we need additional protection. So wear masks, as people say, I stay at home, I wear my mask, I do, but you need additional level of protection. So look at some of the vaccines that have been around. We know all these, but COVID-19, the coronavirus vaccine is what we're talking about. But the diphtheria, hepatitis, and H flu, HPV vaccine, you know, by the time a child gets age 5, it had about 33 vaccines in Barbados. Chickenpox vaccine, yellow fever, we've all taken those vaccines and we didn't complain. Now, the World Health Organization has given emergency use approval for 6 vaccines. I was hearing 7, but I can't find which one is 7. The Pfizer, AstraZeneca, Johnson & Johnson, the 1 dose, the Moderna, the Sinopharm, which is here, and the Sinovac. The FDA, which is the US authority, they gave full approval for the BioNTech vaccine, which is a first for the COVID shot in the US, and it paves the way for new vaccine mandates. So the US has said, you know, it's not emergency use. We check it and it works properly and we give it full approval. Now, sometimes when you get vaccines, when you get drugs, when you get anything, you might get a reaction. And I don't call it side effects, a reaction. And as children and as adults, we've had vaccines that get some reactions. We get soreness or pain at the injection site. You may get itching at the injection site. You may get a fever, fatigue, muscle aches, headaches. Most of these within 24 to 48 or maybe 72 hours, they dissipate. Or you may get no reaction at all. Looking at statistics up to September 28th, and Dr. Fernand would update me. The last figures I got was that there were 400 plus adverse reactions. These are the number of doses of vaccines that were given up to September 28th. And there were 422. That was back in earlier in September. And there were 3 serious reactions reported. And we have a committee in place in Barbados headed by Dr. Miriam Hines, who looks at these details. But this morning, look at our newspaper, COVID storm. It showed you the number of patients at that time from yesterday morning that were in secondary care. Critically were 7, 17 on severe disease, 21 were on ventilators, 33 of these patients were unvaccinated. That was then. Some of those persons have passed away. As you know, in the last 24 hours, 7 persons have passed away in Barbados. The dashboard that we see that came out today from yesterday, see was 5 deaths, and we've had 8,381 cases. And look at this, 200 new cases in the last 24 hours, 201, okay? And 39 of that 201 were under the age of 18. And the chief medical officer said yesterday that 60% of those under 18 were under 12. That is cause for concern. So we've had now 74 deaths. I think there's 75 or 77 deaths now in Barbados, because this is talking about yesterday's death. So we're rising. We're in trouble, people. The University of West Indies, the COVID-19 Public Health Group, they put out this statistic every single day. And they look at the number of case rates per 100,000. Look what's happening. Barbados is a flat country, but look where we're going up there, all right? Almost to the 50 cases per 100,000 cases in Barbados. And that compares, in looking at the Caribbean statistics, only Suriname has a higher case rate right now from the statistics I saw. I might be wrong, but that's one I saw. So let's look at some of the vaccines. The AstraZeneca I got. This is an adenovirus vector vaccine given, I think, between 8 and 12 weeks. I got mine in about 10 weeks. By the way, I was number 42. I wanted to be number 1, but I was the 42nd person to get a person in vaccine according to my card. And let's get my first dose there. The efficacy is thought to be about 90% 2 weeks after the second dose. So after you have the second dose, and we only have 2 dose vaccines here in Barbados, after the second dose, usually administered in the non-dominant arm, 2 weeks after, you can get the vaccine. And there are many sites available, pop-up sites and polyclinics and specific locations to have these sites. And I was out there doing some of the assisting in the initial rollout. I'll be back out there again. The Sinopharm, or the Sinopharm, is also available in Barbados. Given by two doses, is an inactivated whole virus. So it uses the old technology that we use for vaccines. So if you're scared of the new technology, you can use the Sinopharm. And in 4 weeks, you have the 2 doses. 2 weeks after, you're fully immunized. It has an efficacy of 79%, almost 80, 2 weeks after. And it was approved by the World Health Organization in May. It was on the market since December last year, and billions of doses of these have been given. And is also for adults 18 years and over. The Pfizer uses the new technology, the mRNA technology, and what that does is teaches the cells to make this harmless protein that triggers the immune response, produce antibodies. The cell then make copies. The mRNA is destroyed, given in 2 doses, but the mRNA never enters the nucleus of the cell. It does not change your DNA, although I wish it would for some people. But it does not use a live virus, and it cannot give a recipient disease. And that's what characteristics of the vaccines. Should we get a booster third dose? The jury is still out. We know that in Israel, they've been doing a lot of trials, and they've been doing it in their population. In the US, they've now said it's authorized for immunocompromised patients or persons over the age of 65 who live in a long-term, or persons who live in the long-term care facility, or over 50 if you have over 50 if you have underlying conditions. And that's mainly Pfizer, from my research, have been the persons who said you should get this booster. What they found is that the immunity, the antibody levels wane after 6 months, and that's mainly with the Pfizer so far. So far, the studies with the other ones, AstraZeneca hasn't shown much waning so far. If you're pregnant, you can take the vaccine, especially in the 2nd and 3rd trimester. If you're breastfeeding, you can take the vaccine. And this has been endorsed by the Barbados Association of the Obstetricians and Gynecologists. In taking the vaccine, you have to look at the risk versus the benefits. And the benefits far outweigh any risk. And how this was found out is that during the trials, they told the girls, don't get pregnant, because we don't know how this thing will work. You know, the girls when get pregnant, when they check, they saw there was no ill effects to the ladies or the unborn or the child. So it has been endorsed. You can know, and you should take the vaccine because you don't want the problems. Now the variants have come along, and viruses always like to change, like to mutate in order to live. New variants of the virus are expected, and some come and some disappear. Some make things worse and some disappear, but there are 4 variants of concern at this time by the World Health Organization: the Alpha, the Beta, the Gamma, and you hear a lot about the Beta, the Delta. The Alpha was here before. There are also variants of interest, things that they're monitoring: the Eta, Iota, Kappa, Lambda, and Mu. I heard there's another one called B1, but the World Health Organization hasn't said much about that just yet. The Delta that's running rampant about here is found to be more infectious, and the time between exposure to the positive test is a lot shorter. It replicates faster. Incubation period between the time you get the virus and get symptoms is quick. Greater viral load and shedding. I understand that you can get 1,000 times more virus in the nose than with other things. 64% more transmissible, and therefore it is more easily opportunity to infect other persons. It's been in Barbados since the middle of this year, and as you'll see from the numbers, as you saw from the numbers are going up. What we have found is that between 15 and 20% of our positive cases these are positive confirmed cases, are under the age of 18. The American Academy of Pediatrics, they find that 13% of their cases out there are under the age of 18. But children can become seriously ill and severely ill and even die from COVID. We had one death so far in Barbados from COVID-19. Children with underlying conditions are more likely to have problems: diabetes, obesity, asthma, congenital heart disease. And some children sometimes may experience the symptoms of COVID-19 long after the initial recovery. And my concern is what's going to happen to our healthcare services when we get over this hump or this mountain that we are climbing. The Pfizer vaccine has been shown to be effective in children between the ages of 10 and 12, but enough of them are not being vaccinated yet. Even though the mothers and parents are being vaccinated, parents are not taking them out as they should. They're working on a vaccine now for children between 5 and 11, and that will be at 10 micrograms rather than the 30 micrograms that you're getting for the adults and 12 years and over. Unvaccinated persons account for more than 10 times as many serious cases as those who are vaccinated. I had this slide written before the 5:30 news, but there has been one death of a fully vaccinated person in Barbados, reported over the last 24 hours. But it is expected, okay, you get breakthrough cases. 99% of the cases of COVID-19 deaths are in the unvaccinated. That is what the national statistics do state. Unlike vaccinated persons, unvaccinated persons can be more symptomatic of illnesses and require intensive medical care. And looking at this statistic here, this table from the COVID communications unit, and this was, shows, this is September the 28th, shows that in the primary, where they have the serious cases, the fully vaccinated were 0 at that time. 2 were partially vaccinated, but most of the persons in the intensive care unit on the ventilators were in the unvaccinated group. And if you go down here, you see most of the persons overall seen in the statistics up to 12:30 p.m. on September 28th were unvaccinated. 78% of the persons were unvaccinated. And most of them, and of those, some were serious. Of course, there were vaccinated persons. Most of them were not serious at all, and they're not necessarily at the Harrison's Point facility. There may be any other facilities, isolation facilities that we have presently. So why should you vaccinate? You should do it for yourself, do it for your family, do it for your work colleagues, and do it for your community, be it the sporting community or your community and colleagues. Do it to help us reach herd immunity. Do it to get back to normalcy and let us have some more sporting activity. You have to balance the unpredictable risk of COVID-19 and the variants versus the very small risk of taking the vaccine. Why vaccinate is the best chance between lives and livelihood. So we should walk, run, jog, line up if you have to line up, because you line up to go to the bank, you line up to go to the, I don't know if the cinema is open, you line up to go to the drugstore, you line up to go to the supermarket and the other markets, you can line up and get the vaccine and you don't have to pay for it. So if you believe that the pandemic is almost over and you can write it out without getting vaccinated, you're wrong. COVID-19 could find you. And you don't have to go anywhere. It could come and find you. The 70 people at the psychiatric hospital that had it, they didn't go anywhere, nor the persons at the prison, Dr. Ward will tell you. They didn't go anywhere. It came to them. If you believe that if you get infected and you go to Harrison's Point facility or another isolation facility and get treated, there's no guarantee that you can come back out alive. If you're pregnant and you don't want the vaccine to affect you, your baby, or your future fertility, it matters little if you're alive to see that baby, right? If you believe that you don't want to get your children vaccinated because you don't know what the long-term effects might be, it matters little if they don't live, and you gotta live with that because you might never, they'll live long enough for you to find out. If you believe that you want to get everybody else vaccinated around you so that they will protect you, you have a lot of other unvaccinated people in this herd that don't want to get vaccinated, so you don't depend on anybody. If you believe that vaccinated persons are getting infected anyway, and even dying, so what's the point? Well, generally, the vaccinated people are not dying. 98% of them are not dying from COVID-19. So my message to everybody is don't procrastinate, don't hesitate, don't even wait. Vaccinate because vaccines matter. Roll up your sleeves because vaccines save lives. Thank you very much. Over to you, Dr. Lorde.
Okay, whoa, that was a heavy talk. Thank you very much, Dr. Lorde. And in fact, you're exactly 30 minutes.
Thank you.
Okay, ladies and gentlemen, we'll now open for questions to Dr. Lorde. And you have two options for asking questions. Either you can put the question in the chat room, or you can raise your hand and signal. And when called upon, you can unmute your mic and then ask the question directly. But there certainly during the talk, at least 3 questions came up in the chat, and we'll start off with those 3 questions first, and then we see what happens afterwards. Okay. So Michelle from Solar Dynamics asks that why persons that have recovered from COVID is not treated as vaccinated?
Very good question, Michelle. Now, when you get an illness, you do develop some level of immunity. So you can be vaccinated and not have had the vaccine. But I guess what you're talking about, that person may have what's called a natural immunity. Well, what has been found is that that natural immunity to COVID as a result of having the COVID-19 virus does not really last. And the recommendations from the World Health Organization, and Dr. Fernandez here, is that 3 months after having recovered from the vaccine, from the disease, you should get that vaccine to boost your immunity. It doesn't last very long. So that is the reason why you're not treated as vaccinated. And at present, as far as I know, we don't do routinely antibody levels to see what they are. So it is recommended that you should still get your vaccine.
Yeah, thank you, doctor. To add to that though, after the initial infection, you don't know, most people don't generate a large enough antibody response that gives them prolonged immunity. And also we can't measure the T-cell response, which is another arm of the immunity, which we're not good at measuring, but you do seem to get some T-cell response, both from the natural disease and from the vaccine. But we can't quite measure that yet, but we know that does happen. Thank you. The second question comes from Craig Archer. So good night, Craig. If a sports person has been fully vaccinated with the Sinopharm vaccine, but now needs to travel to, say, Europe, can they take 2 jabs of either the Pfizer or AstraZeneca and be double dosed?
Very good questions, Craig. At this time, even Canada has not been accepting the Sinopharm, but they say that it is under review. So I'm hoping that in the near future that it if this is really so, also in Europe, that that they would accept, because the World Health Organization has decided to do this. But the European, they have their own vaccine agency, and at one stage they were even looking at not accepting AstraZeneca vaccine, which should now be accepted. So I'm hoping that in the future this would not be a problem. But your question is, can they take? I don't think that they should take the Pfizer or AstraZeneca, because we don't know what could or would happen to them.
Yeah, that question is now being studied. So, we don't have an evidence-based answer for that at this point in time.
Correct.
Okay. Question number 3 from Charlene Leacock. If a person recovered from COVID, how soon after can they be reinfected, and can they spread it to persons within that period?
Well, as we mentioned, that your immunity does wane, and we don't know how soon the response would be. So I can't tell you a time period. As I said, the 3 months is when you can be, we recommend for the immunization. But your question, can they be infected? Yes, there have been cases of persons who have had COVID-19 more than once, and that shows you, that's why I said the immunity has waned. And if they get reinfected, of course, they can then spread it. But after they've recovered from isolation, whether it be home isolation or the institutional isolation that we have in place at this time, then they can, they are free of the virus and transmitting the virus and so on. So they shouldn't spread it to any person at all. But if they get reinfected, then it can happen.
Yeah. The other part answer to that is that because we have all these variant strains coming up, you can kind of recover from one strain and get hit by another strain later on. Strains that are more transmissible or more virulent. So different strains makes this a very hard answer, or very hard question to answer.
Right.
Okay, question number 4 from Jamie Skeet. What is the procedure for fully vaccinating persons coming to Barbados for sporting events?
The procedure for sporting events is the same as for anybody coming in, sporting or otherwise. So for Jamie, you can, if you are fully vaccinated by one of the recognized vaccines, and we have listed the vaccines, the one I've listed there, in addition to the Moderna, in addition to Johnson & Johnson and Sputnik 5, I think. Those are the ones that I can remember off the list. And you can visit barbados.org and get that list. Then you will be swabbed on arrival and you quarantine for 24 hours. However, if you're coming from Brazil, if you're coming from South Africa, or if you have been in those places and there's another country in the last whatever weeks, then you have to quarantine for 7 days before, fully vaccinated or not, you quarantine for 7 days before you're allowed to leave the quarantine. So you're quarantined at a designated quarantine facility, which will be one of the hotels at your expense for that period of time.
Thank you. Craig Archer wants to know that, can GPs administer vaccines from their private practice now in Barbados?
The answer is yes. There have been training of general practitioners in Barbados and pediatricians, and it's being done presently already. Over the last 2 weekends, the GPs will, after the training, they will contact Dr. Ferdinand and they will get vaccines in certain allocations from the vaccine center, which they must collect, take to the office. They must also have a refrigerator that is dedicated to the vaccines. The temperature in the refrigerators must be checked twice a day, and they must report how many vaccines they're given. The difficulty I find with that, though, is that because of the AstraZeneca, it's 10 doses, it's possibility of wastage, because you have to give that 10 or maybe 12 that you get out of the 10 that same day. You can't put it back in the fridge and give next tomorrow. And the other thing, and you know, people don't keep their appointments. The other difficulty that you have is you have to have a dedicated fridge. The other thing, you have to go and collect it yourself. You're going to get some compensation from government for doing this, which is neither here nor there for me. But also, you have to input all this thing in a computer. You have to also observe the person for 15 minutes. So it's difficult, really, for a single practice to do it. If you're in a clinic with a number of practitioners or in one of the emergency clinics, I think it probably could be held, but a multi-practice clinic could do it, but it's going to be difficult for single practice to really do it. But there are GPs that, the answer is yes, they can do it, and they have been doing it.
Or at least it's an attempt to get this on stream, even though it's not actually started just yet.
Yeah, some doctors have started already.
Okay.
In the Belleville area.
Okay. The next question. Just get this up.
May I ask a question, please?
Yeah. Okay. Just hold on. Let me do this one, and then I'll let you come on. Kendia Braffett would like to know that, is there any evidence that the vaccine can or has affected the female monthly cycle in any way?
I'm not aware of any effect that the vaccine would have on the female's monthly cycle or their fertility in any way. It shouldn't.
Okay, there was a voice that came through to ask a question. I didn't see a hand raised.
So I can go ahead?
Please do. Oh, that's Ken Morabino. Good night, sir.
Good night. You didn't need to call my name, sir. Dr. Lorde, what I want to know, the mantra is that you should try to find out as early as possible if you have the COVID. What I'm trying to determine is what kind of treatment is given to you when you are COVID positive. Do you go down at Harrison's Point and just lay down and people watch you, or you're given some kind of medication?
Well, it depends on whether you're symptomatic. Good questions, Kenmore. Whether you're symptomatic or not. So if you have COVID-19, and it also depends on what your count is, the viral load, so to speak, if you want to put it in those easier terms. So if you are COVID-19 positive, you have no underlying medical conditions, you have no symptoms, no fever, no shortness of breath, then you will go into the tertiary section. You're assessed by Dr. Ford's team at Harrison's Point, or you should be assessed by the team, and then they would allocate you to whichever department they have, which would be probably the tertiary section where they're asymptomatic. Of course, you also can be reassigned out to any of the other isolation areas, like our school, Foundation School is one of them, Queens College, Lester Vaughan down the road from me, Darrell Jordan, or maybe in one of the hotels. I'm not sure if they're using those for isolation as well. In the situation now that they're doing now, as Dr. Grantham is showing now, the possibility is also there for home isolation. So yes, you can be asked to go down there and lay down or run around the place and play some volleyball and cricket or football with the other persons of your status.
And one other question which I have, the world is being, destroyed by a flood of COVID issues, huh? But what is the medical profession doing in terms of the tidal wave of ignorance? Because it seems that today we have a medical problem, we have a scientific problem, but the social media, you are just a social media addict as I am, but the social media is being driven by a level of ignorance where persons seem more prepared to listen to the snow cone vendor or the ZLR driver as opposed to a medical practitioner. What is the medical profession doing to try to do something about this tidal wave of ignorance?
Well, I see that some of the social media, YouTube and Facebook, they've now been trying to remove some of the people who have been pushing this thing about. I think it's just about education and communication. And what we failed to do here, because it came on us suddenly, and I don't think we expected that type of reaction in Barbados and the Caribbean, because I see some people from other islands online, is to try to educate you. I think, personally, I think that people's confidence in the medical profession has been waning a little bit over the years due to Dr. Google and other doctors, online doctors. But I think we needed to get out there and try to give the information. I think that, and you know, since we have the public's communications officer, I don't remember what the name is, I've seen over the last 2 weeks a lot more education going on. But the medical profession, yes, we need to be out there a little bit more to try to tell persons what it is and make themselves available to answer any queries that persons may have on these conditions, on this condition.
Just a quick addition to that. Certainly in other places, people with specific financial interests have been plugging this false information. For example, there are doctors who say, don't take the vaccine because they're promoting hydroxychloroquine or ivermectin and the like, you know. So people say, no, don't take the vaccine, take this vitamin or take this tonic or whatever. So, you know, when there's a financial interest to it, you know, people do anything. All right. Natasha would like to know, are there any significant negative effects on specifically 12-year-olds? I presume she means younger patients, 12 to 18, in Barbados to date, who have taken the vaccine?
I'm not aware of any problems. I've heard that one child fainted after taking the vaccine, but that is not something that's unusual. But generally, internationally, there's nothing that has happened to them out of the ordinary at all.
Okay. Dr. Branford Jones would like to know, with the new observations abroad of the possible benefits of mixing vaccines, do you know if this will be considered or become acceptable in Barbados?
Yeah, a lot of studies are going on internationally about the mixing of vaccines, and some results are coming in. And I think that once we recognize the science, then we might very well consider doing that if it is thought to be necessary, but we need to get the vaccines to mix first. It's not what we've been practicing, but is something that may be considered based on what the science says.
Okay. A famous athlete named Gabriel Burnett would like to know, if someone was released from the isolation center, should they be allowed to be involved in sporting activities? And what is the risk of others contracting the virus? I heard the response about 3 months.
Yeah.
About 3 months ago. Yeah.
No, that's the 3 months. Yeah, that's the 3 months for getting the vaccine, getting the vaccine. Yes, Gabriel, very good question there too. If someone has had the COVID-19 virus, they should be very cautious in getting back into physical activity. We have had several cricketers, the Hayden Walsh, I can remember there is the Hope brothers got the COVID-19 virus in cricket, and they went on to go and play almost immediately in the regional competition in St. Kitts, and the Hope brothers have gone on. One of the Hopes that they went to play for the West Indies. You need to have, those persons should really have a full physical examination, including electrocardiogram and possibly even an echocardiogram because of the myocarditis, and be monitored closely. So Gabriel, in going back into competition, it should be a gradual thing, although we have seen athletes go back into it more aggressively, but we have had a sudden death of an athlete in football in England who had COVID-19, and he had myocarditis, which is inflammation of the heart, and nobody really recognized it. And he died on the pitch. So I would say in 3 to 6 months, the talk about the 3 months is 3 months after when the body gets the shot. But once you've recovered, there's no possibility of that athlete passing on the virus to other athletes or other persons. You're recovered from the virus. I assume they do the PCR test. PCR test is negative, although you must recognize that sometimes the PCR test picks up some dead virus particles. And we've had one person in quarantine for 4 days, feeling well and testing and finding positive all the time. And then they realized it wasn't active disease that the person had. So, but the person should be monitored by a physician before, during, and while they're in training and competition.
Okay, my apologies to Lady Ford, whose hand has been up for quite a while. So please, Madam Ford, please address your question to Dr. Lorde.
Thank you, Dr. Lorde. Dr. Lorde, just going back to the question about athletes coming into Barbados for competition, and you said once they're fully vaccinated, they go through the usual quarantine period and so on. But could you be specific when you say fully vaccinated? They must be fully vaccinated 2 weeks prior to entry?
Right. Yes, fully vaccinated and fully immunized. Vaccinated is when you get the vaccines. Immunity is 2 weeks after the last vaccine, right? So it's fully vaccinated and immunized. Thank you very much. That is correct. So it was 2 weeks after the last vaccine that they will receive, and then when immunity is thought to be at its highest.
Yes, the reason I'm asking, I have a specific case where we've been requested to ask for an exemption. And I said, no, I can't do that because that's a stipulated period. And, you know, you start asking for exemptions, where does it end? That's my take on it. So I've said, no, it has to be the 2 weeks because that's what I understood it to be.
Right. And if you know our chief medical officer, he's not going to bend at all.
But no, I didn't want to even approach him with that.
Yeah, he's not going to bend at all.
I approached him to waffle on other matters.
Yeah, so you can't take that chance.
Thank you.
Okay.
Craig Archer has come back at you, Dr. Lorde, and he wants to know what are the positive and negative benefits of the use of these treatments we have heard about, like ivermectin and hydroxychloroquine.
I know of no positive benefits from those treatments. Ivermectin is a drug used for parasites in animals, I think it is.
Yes.
Right. And is one of the President Trump's favorite things as well. Hydroxychloroquine, that has been proven that it's not effective, but there are a lot of people out there still pushing this ivermectin, especially in home isolation situations. Even some of my colleagues, some of my classmates in Jamaica, they've been pushing the ivermectin, but it has not been shown, it's not approved by the World Health Organization, and not shown to be of any additional benefits. I don't know if Colin, you want to add anything there?
No, I know it has been promoted by doctors who have shares in the companies that sell them.
Yeah.
So, you know, they have a financial interest to it.
Yeah.
I know Craig has a second question there, but I'll go down to Charlene Leacock. If my computer would allow me. Sorry. Dr. Lorde, you just said that a person recovered should wait 3 months before being vaccinated, but other doctors have been saying 4 to 6 weeks. How would it affect a person if they were to be vaccinated before the 3-month period?
Well, we are going with what the recommended. Initially, the World Health Organization and PAHO had said like a month after, but now they've gone to 3 months but as far as how would it affect you, it shouldn't affect you negatively, but we just recommend, this is a new disease, new virus, and we are learning as we go on. And I think what has caused a lot of problems, going back to what Ken Moore had asked and so on, is that, you know, at first we said, you know, just don't wear masks. And then we said, don't wear those medical masks, wear cloth masks. And then we say 3 feet, and then we go and say 6 feet. So they've lost confidence in all of us. We don't know what we're saying, but we are now getting additional information from scientific papers and so on that we're reading and people who have researched the thing, and now we're finding that this is what we really need to do. And on top of that, now the variants have come along and changing the whole focus all along. So that is probably why this was said, but it wouldn't affect you negatively if you had to. On that point, if you had, we have children now who have just gone into secondary school, 11 plus. They would have had the diphtheria and tetanus and I think maybe polio prior to going into secondary school. Or say that your son had a cut or nail juke, as you call it, and gets a tetanus shot. You need to wait 4 weeks after having any other vaccine before you get the COVID-19 vaccine. Or if you've had the COVID-19 vaccine, if, of course, in an emergency, if it's an emergency situation, you need to give, but for the routine vaccinations, if you've had the COVID-19 vaccine and you need to get a hepatitis shot to go and work at the hospital or to work at the Parsons Point, you need to wait 2 weeks after having that second shot before you have another vaccine. Because, you know, the immune system is still working, okay? And we don't want to overwhelm the immune system. And that is what could happen if we give the vaccine too soon after having recovered from the condition. You don't want to overwork the immune system. It can do so much.
Okay, thank you. Dr. Bradford Jones asks that, with the rise in numbers and deaths while we are trying to return to some semblance of normalcy, how much sport and sportspersons have suffered? What is your position on mandatory vaccinations, especially in medium and high-risk sports?
I think you need to make you have a choice right now, but you're saying in medium high-risk sports. I think if Dr. George were to hear that all of the contact sports persons were vaccinated, he would feel comfortable in allowing the contact sports to start taking part, start back, to resume activities. So I don't have a position on it, but I feel, but having said that, I feel that all sports persons and sports officials representing Barbados and leaving the island, having to leave the island to compete overseas, should be vaccinated. I now feel, because of the rising numbers of cases and deaths, that we sports persons, administrators and so on, I'm a sports person too. I ran my first 5K ever last year, being defeated in my age category by Reverend Noel Burke of St. David's, Canon Noel Burke. But we need to set the example. We need to be out there telling people why we want to be vaccinated and encouraging our peers that may not be as sports worthy or sports friendly as we are to get that vaccine. Because people look up to sports persons, people look up to the coaches, people look up to these idols and icons. And we need to get out there and tell them, I've been vaccinated, let's you do it, if you understand why. And so that you don't have to mandate it, you just do it.